Good evening. My name is Erin Scott. I am currently doing a presentation for oral communication. Do you have a loved one that is in need of assistance with activities of daily living? Do you feel that they need more personal care, but you're not comfortable with having them and being placed in a facility? It is completely understandable about your feelings about having your personal loved one in a facility. I would like to go through a few different options that you have having your loved one in their home and having home care for them instead of deciding to place them into a facility. Home health care services are given to someone due to recent changes in their health. The term from home care is used to distinguish custodial care, which is care that's provided by someone that is not licensed, either it could be non-medical, and home care is provided by someone that is licensed. A couple options that are available would be nursing care services, which include in-home assessments, medication management, oxygen therapy, and rehabilitation services. The next options that you have available will be personal care services like bathing, grooming, dressing, companionship, incontinence care, also household management around the house. The benefits of home care services are that a survey shows that 90% of seniors want to be able to stay in their home. It provides comfort, makes them be familiar to their surroundings, and if they had to move out, they're going to start all over. They have to start over being able to identify their surroundings. If they have Alzheimer's, they're going to be a lot more confused, disoriented. It'll be really difficult, and that's something that we don't want to put our loved ones through. Personally, I can understand that. Being able to have them stay in their home lets them remain independent as possible by letting them be comfortable, showing them just ways to be able to have a better life in their home without just taking them away and placing them in a facility where they have to start all over again. For example, if you had a hip replacement at a hospital and they were sending you home, instead of you going into a rehab, you would be able to have physical therapy come into your home and help you with rehabilitation. And you'll also have a home health aide that will be in your home that will help you with your daily activities of daily living. They will be able to, assist you to the bathroom, help you do transfers, help you, around the house with the things that you're not able to do during your recovery time. Also, it's been shown that recovery time is a lot more less than it is with you being in a facility because you're in your own natural habitat. A study also shows that patients that have home health care go to the doctors 25% less than somebody that without home care, they go about 50% more or less. Cost of care for home care services versus continuing care services in a facility. According to the 2012 Genworth Financial Survey, that was a national average of all seniors that was given about seniors' cost of living. For a nursing home, it is averaged out to be about $222 a day for a private room and about $200 a day for a shared semi-room, private room. But that is not including any medical care provided. For a assisted living facility, it is averaged out to be about $3,300 a month. And that all depends on your level of care. The worse you get, the higher level of care, the more you're paying for that. And assisted livings will provide about 2 meals a day. They'll have your housekeeping. They'll have someone come in and with your personal care, and you'll have aides that are there. But at the same time, you get more sick, your level of care is going to go up. For home care now, the average rate is about $18 an hour for four or more hours, and then if it's 2 to 3 hours, if you have a doctor's appointment and you have to go somewhere, that would be about $25 is the average, and then I think the highest average right now is about $35 for 1 hour if you just want someone to come in. Again, there's different prices, like for live-in, someone that does stay in your home 24 hours a day, 7 days a week, they average out to be about $250 a day for someone to come in. And again, yet everything's being included, and even if your level of care goes up, you're still being provided at that $250 a day with a live-in. So you also have med management. You have someone just coming in there to do a bath visit if that's all you need, if your level of care is not to the point where you need someone there continually for more than 4 hours. There's a lot of other benefits, price-wise, that won't be running you, to where you're financially in strugglement to provide care for your loved ones. It is a good thing to look into the home care health agency. Make sure that they're licensed and bonded. That way you know that if anything occurs, that everyone's covered. There is a difference between registries and licensed home health agencies. With registries, the caregivers are contracted with themselves. So if anything happens, there's not much coverage. It's going to be between you and that caregiver. Also, you should find out what type of insurance your home health agency takes. Some home health agencies take Medicaid, some take Medicare, some take long-term care insurance. There's also veterans benefits that are provided. You have Jewish families. There's a lot of different types of programs that each senior person has. So you want to try to make sure that the agency that you have or the one that you choose for your loved one can help you in the most way financially. That way they can get the best quality of care. I also do know that a lot of our agencies, such as mine, we subcontract with a Medicaid provider, so that when the client's Medicaid runs out, then we are able to bring that client over to us and we work out something that won't be too financially expensive for them, because we know that their Medicaid has run out, but they're able to still have services. So it's a good idea to really research and find out about your agency, what they're able to provide, about the cost. Do they check backgrounds for your caregivers? Are they licensed? What else could there be? About the nursing, about plan of care. What's the plan? Make sure you always have an assessment done. Our agencies, we go out, that's our first thing. We have an initial assessment where we go out, speak with them about their concerns. Also, try to get a solution of the most lowest cost possible, but yet they get the best quality of care. Also, again, find out if your loved one has Alzheimer's. A lot of home health agencies train their employees and caregivers that come in to have the understanding of Alzheimer's. We have our Senior Gems program that we do for our caregivers. More than 50% of our staff is trained in knowing different levels of Alzheimer's and how to take the right approach. So that's really big, because a lot of seniors are dealing with Alzheimer's and dementia. And you want to make sure that the person that comes into your home that wants to provide that care has that understanding and the capability to provide the necessary cares for your loved one. My references have come from Aging and Disability Resource Center of Broward County. Also, it came from Senior Living. The sources that I used are Senior Helpers, which is the company that I work for. Also, Social Work for today, I used Genworth and Home Instead. Those are all 4 of my sources that were used in 2 of my main reference articles that I used on the web. I hope that you enjoy this. I hope it opens your opinion on making the choice to keep your loved ones in home and having home care services rather than placing them into a facility. If you have any other questions, like I said, you can always go to all these resources that I have provided and really get some knowledge and understanding about what you need. I hope you enjoyed my presentation and you can have a great evening.